You are. Please carry on.
First of all, I would like to thank all the members of the organizing committee for giving me this invitation to present in this esteemed conference. And the topic of my presentation is hypoglycemia, all you need to educate your patients about. So if we talk about hypoglycemia is one of the most common limiting factor to optimum control. And it not only creates issue for the person living with diabetes, but also it creates a psychological distress for the family members also. The key components which are required for of diabetes care are monitoring of hypoglycemia, and which is important to maintain blood glucose for more than 70 milligram per deciliter and achieving best possible glycemic control without occurrence of hypoglycemia. If we talk about incidences of hypoglycemia over the years, although the incidence of hypoglycemia and the rate of severe hypoglycemia has reduced because of the intervention of the new insulin analogs and advanced technologies which are used in diabetes management and improved hypoglycemic education for hypoglycemia. The distress which hypoglycemia brings to the body not only is limited to the psychological, but it also affects the cognitive dysfunction, structural and functional abnormalities of the brain. It increases the risk of epilepsy in later life and also increases psychosocial negative consequences like fear of hypoglycemia, anxiety. It compromises academic and the physical performance and also sleep patterns. If we talk about what we need to educate people living with diabetes when they visit us for the counseling, then there should be a proper checklist of the topics which needs to be covered when we give hypoglycemia education, which starts with first the recognition of hypoglycemia and to confirm the levels of the sugar levels at the time or the patient experiences the symptoms, to differentiate between mild, moderate versus severe hypoglycemia, how to treat hypoglycemia and how to avoid over-treatment of hypoglycemia, and to avoid hypoglycemia, what all the precautions they can take to avoid hypoglycemia in future. Now coming to the recognition, how to recognize hypoglycemia. So if we talk about the particular level of hypoglycemia, so as such different people can have different intensity of symptoms at different levels. But as per ISPAT guidelines, the hypoglycemia can be divided into three categories. First is the clinical hypoglycemia alert, which is usually the threshold level is less than 3.9 millimoles or less than 70 milligram per deciliter. The moment blood glucose levels drop below this level, the action needs to be taken to treat hypoglycemia. If we talk about the acceptable CGMS targets for hypoglycemia, for this range, it is less than 4% or less than 1 hour per day. Now, coming to the second category, which is clinically important or serious hypoglycemia, for this level, the threshold is less than 3 millimole per liter or less than 54 milligram per deciliter. This level also requires hypoglycemia treatment, and acceptable CGMS target for hypoglycemia for this range is less than 1% or less than 15 minutes a day. Talking about the severe hypoglycemia, there is no specific glucose threshold for this range. The only thing according to which it is diagnosed as severe hypoglycemia when a person is not able to take action by themselves, when they require third-party assistance to administer carbohydrate or glucagon or intravenous dextrose. That is the situation where we say that this is severe hypoglycemia. Coming to the signs and symptoms, how people will able to recognize that they have hypoglycemia. So they can get different symptoms for hypoglycemia. At the time of when the sugar levels drops below 70, the first category of symptoms which people feel is autonomic symptoms, which includes shaking, sweatiness, trembling, palpitation. As the sugar levels drops further, they feel neuroglycopenic symptoms, which is more related to coordination and concentration. They experience poor concentration, blurred vision, slurred speech, confusion, dizziness, lack of coordination. Then they can also experience behavioral symptoms like irritability, erratic behavior, agitation, nightmares, and some non-specific symptoms like hunger, headache, nausea, or tiredness. Whenever we explain about these symptoms to people, often when we say excessive sweating or trembling sensation, they tend to correlate with what they experience. So very commonly we hear कि हमें तो sweating दिन भर होती है, or I sweat more. So here we have to emphasize on two things. One, every individual will not experience all the symptoms, and whenever hypoglycemia will occur, they will experience more than one symptoms, and the experience of symptoms is usually common in different individuals. So if a person experiences 3-4 symptoms, so most of the time they will experience those symptoms repeatedly. Talking about the clinical factors which can be associated with hypoglycemia. So mainly the main precipitating factors which can be associated with hypoglycemia are mismatch between the insulin dosage and the consumption of food, or sometimes if people accidentally take more insulin or wrong dosage or wrong type of insulin, when there is excessive exercise on a particular day, or suddenly they start doing exercise but they start with longer duration. Sleep and alcohol ingestion are the major precipitating factors which are dependent on the individual care. Then there are other risk factors which include impaired awareness of hypoglycemia, previous severe hypoglycemia, and longer duration of diabetes because it affects the nervous system. Then comorbidities like celiac disease, Addison's disease, hypothyroidism, and some psychological distress can also be associated with hypoglycemic episodes. If we talk about the major precipitating factors, coming to exercise, moderate intensity exercise can trigger hypoglycemic reactions. In this case, it is very important to understand that hypoglycemic reactions can be immediate or it can last up to 7 to 11 hours also in case of type 1 diabetes. So that's why if suppose a child do excessive activity during evening time but experience hypoglycemia at midnight, then we have to correlate it with the activity or their eating patterns also. If suppose someone wakes up with and has low pre-breakfast blood glucose with bedtime BG less than 5 millimoles, and if they wake up with lethargy, confusion, nightmares, headache, or impaired thinking and seizures, then it is important to suspect some nocturnal hypoglycemia in that situation. Coming to another thing, that is alcohol ingestion. Alcohol inhibits gluconeogenesis. So hypoglycemia may occur if there is inadequate intake of carbohydrate. But here the other problem is that symptoms of hypoglycemia may be marked by the intoxicating effect of alcohol, because alcohol is not only a drink which has variable amount of carbohydrate, it is an empty calorie drink which gives a lot of calories. So it is very important to take moderate amount of alcohol, and also whenever alcohol is consumed, they should be educated to take carbohydrate along with the alcohol, and they should not take alcohol empty stomach. Their insulin dosage needs to be well regulated. They should not take excess amount of insulin, and more frequent blood glucose monitoring is required when alcohol consumption is there over the night. Now, the other factor which is associated with hypoglycemia, which is very important to discuss, is impaired awareness of hypoglycemia. This is the inability to detect hypoglycemia when it happens. So in this case, actually repeated or recurrent episodes of hypoglycemia creates a situation wherein our body becomes comfortable with that range and people are not able to detect hypoglycemia at an early stage. So this happens because of defective counter-regulatory hormone response to subsequent reductions in blood glucose levels. And it is also reported that nowadays, if compared to earlier studies, the incidences of impaired awareness of hypoglycemia has reduced, but this can increase the risk of severe hypoglycemia to 6-fold. So whenever a person comes and whenever we see the glucose charts and we see repeated hypoglycemias at some point of time, then it is very important to consider what is the root cause of this. And secondly, to remove this situation or to get rid of this situation, the strict sugar control is not advised. So here it is advised to reduce the insulin dosage and bring the person to a relaxed sugar pattern so that they can experience the symptoms at the right range. Now coming to the treatment of hypoglycemia, what to do if people have hypoglycemic symptoms? So it is very important to make them understand that there can be two situations. One, when a person has hypoglycemia and the person is conscious and able to swallow, then it should be treated orally through mouth. But how much glucose or how to treat that thing? So hypoglycemia should always be treated with fast acting glucose, but fast acting carbohydrate. But these fast acting carbohydrates should not be given in the same amount to every child. So the amount which is recommended is 0.3 gram per kg body weight of fast acting carbohydrate. So if the child is less than 30 kg, glucose will be required, and if someone is equal to or more than 50 kgs, then approximately 15 gram of fast acting carbohydrate will be required. If suppose an individual is on insulin pump and glucose levels is less than 54 milligram per deciliter, then it should be treated orally and the pump should be suspended till the time glucose is more than 70 milligram per deciliter. Once the fast acting carbohydrate is consumed, they should be advised to rest for 15 minutes so that this can act. And after 15 minutes, they should recheck the blood glucose levels and see what is the range. If the blood glucose level is still low, then they should retreat it. And once the blood glucose levels are settled, then they should eat some snack containing 10 to 15 grams of carbohydrate along with the combination of protein so that the blood glucose levels should not drop further. So examples of 15 grams of carbohydrates, fast-acting carbohydrates are 3 teaspoons of glucose powder or glucose tablets can be taken, or 3 teaspoons of sugar, or 150 ml of juice or regular soft drinks, or 15 ml of or honey. So here there are 2-3 points which should be kept in mind. The soft drinks which are used here should be regular, not the sugar-free ones. And glucose is the most potent choice or the best choice for treating hypoglycemia. When other substances or other fast-acting carbohydrates are chosen, sometimes they can react differently in some individuals, or more quantity of these fast-acting carbohydrates can be required in certain individuals. Here, it is also important to emphasize that this hypoglycemia is the treatment. These are the treatment choices for hypoglycemia. They are not treats. Many a times it happens with kids or people, they get overwhelmed when they have hypoglycemia because they think that now they can eat sweets and they can choose multiple options. So this is not the time for treat, this is the time for treatment. So that's why if in case you notice that the child or the person has developed affection for having juices or soft drinks to treat hypoglycemia, that can be a reason for precipitating n number of hypoglycemias because the child can create a condition wherein they will face a lot of hypoglycemic episodes. So in that case, those options should be chosen for which they don't develop that affection. Also, it is important that while treating hypoglycemia, complex carbohydrate choices and foods containing high fat should be avoided. So cakes, sweets, ice creams, and chocolates are not a good choice because this fat will not allow the glucose to come into the bloodstream very fast, and the blood glucose spike will take longer time. And when the blood glucose level will rise, it will rise too much. Now, what if the person has severe hypoglycemia and unable to swallow food, or it is unconscious? In this case, hypoglycemia should not be treated orally. So it is very important that in this situation, the person should be lied down on the sides to maintain the airway, and they should be administered glucagon either subcutaneously or intramuscularly. So the dosing for glucagon is for less than 25 kg child, it should be 0.5 milligram, and for more than 25 kg, it should be 1 milligram. Apart from this, intranasal glucagon can also be given. If suppose the person is on insulin pump, then and glucose level is less than 54, then insulin pump should be suspended till the time glucose levels come in more than 70 milligram. Once the glucagon is administered, then they should retest the blood glucose in 15 minutes. And if the person is unresponsive, again repeat the glucagon. If suppose it is the person is responsive, then they follow the conscious pathway of increasing the blood glucose levels. In hospital settings, IV dextrose should be administered, and again the person should be observed to repeat the treatment if as in required. But in this case, whenever glucagon is administered, there are 2-3 things which should be kept in mind. It can be administered either subcutaneously or intramuscularly. the person should be lied down on the sides. And in this, whenever glucagon is administered, when the person regains consciousness, then they can have nausea or vomiting sensation. So it is very important to observe them and take care of that situation. And more glucagon is required in the situation that increases the potency of nausea and vomiting. So glucagon comes in a kit like this, which has a dehydrous glucagon powder and sterile liquid. So the sterile liquid is first put in the vial and the solution is made, and then the solution is inserted in the syringe, which is injected intramuscularly or subcutaneously. It is important to administer this solution immediately as it is prepared, and the syringe and it should be kept below 25 degrees centigrade. It should be stored below 25 degrees centigrade. What if glucagon is not available? So in many situations when glucagon is not available, then what we can do, a thick paste of glucose with a few drops of water can be prepared and it can be smeared on the cheek pads. So the efficacy of this practice is anecdotal, but this can be a solution till the time the child or the person is not taken to the hospital. And the study in healthy adult volunteers demonstrated a poor buccal absorption of the glucose, but sublingual glucose absorption was found to be child-friendly when it was administered in kids who were suffering from malaria, and they experienced severe hypoglycemia. Now, there are nasal glucagon options are also available, but it is not available in India. So nasal powder dosing is administered. In this, there is no need to inhale. It has consistent dosing and it has similar efficacy as intramuscular glucagon injection, and it is approved for more than 4 years of age, and single dose of this glucagon is 3 milligram. Now, the mini dose glucagon is also can also be injected in a situation wherein the child is not in a situation to have anything orally or not able to swallow, or if suppose glucose levels are quite low, to increase the glucose levels, mini dose glucagon can also be administered. So it is administered subcutaneously by using 100 use syringe, and 1 unit of 100 use syringe is equivalent to 10 microgram of glucagon. So the dosing for mini dose glucagon is 2 units for less than equal to 2 years old child, and 1 unit per year for children more than of the age 3 to 15 years, with the maximum dose of 15 units. If the blood glucose does not rise, the mini dose glucagon is repeated after 30 minutes using twice the initial dose. So this mini dose glucagon is potent in increasing blood glucose levels for 60 to 90 milligrams within 30 minutes of absorption and 30 minutes of administration. Now, once everything, like whenever hypoglycemia happens, it is very important to treat it immediately. But when we see n number of episodes in any sugar chart of hypoglycemia, or we see scattered hypoglycemic episodes, it is very important to make people understand why this is happening and what are the major reasons behind hypoglycemia. And to prevent hypoglycemia, also it is very important to understand the root cause so that we can eradicate them. So to prevention of hypoglycemia is based on many factors. First of all, it requires a lot of education to make them aware of the precipitating factors. Then dietary intervention, exercise management, glucose monitoring, medication adjustment, everything has to be done. And clinicians visit every time the person visits the clinic. It is important to ask for the incidences of hypoglycemia and what steps they take when it occurs. So proactively, it is important to discuss hypoglycemia at every visit, like how many times they had hypoglycemia, what were the symptoms they felt, how low their sugar levels went, and how do they treated hypoglycemia. Do they carry something in their pocket when they leave the house, or generally what they eat, and what steps they do to prevent hypoglycemia. So these things are very important. Sometimes the symptoms of hypoglycemia and hyperglycemia can be very confusing, especially for people who are newly diagnosed. So that's why it is very important to ensure that they check their blood glucose levels.
Chhavi, you
when
have
they have symptoms.
2 minutes left.
Yeah. So also, whenever their sugar monitoring charts are studied, the difference has to be understood, whether the hypoglycemic episodes are having very frequently at the same time or they are scattered here and there. So if suppose the hypoglycemic episodes are happening at the same time, then there are specific causes and maybe insulin doses has to be reduced. But if they are scattered, then in this case, this can be a mismatch of insulin with the food or the exercise, or some excessive insulin dose is administered. So these factors has to be looked into. So to evaluate and manage hypoglycemia, it is very important to evaluate the insulin administration and to understand what people or the people perceive about their insulin action profile, how they are taking insulin, where they are taking insulin, and how they are rotating the sites, what is the time of injection, and the correlation of insulin injection with the food, what is their food, what is the carbohydrate and protein and fat content of the meals, composition of the meals, and whether they consume alcohol or not. Then activity, timing, duration, intensity, whether they are having pre and post activity snacks or sugar patterns, or they are taking right snack during the activity, or what is the insulin dosing for activity. And if suppose they are having nocturnal hypoglycemia or hypoglycemia awareness, it is important to increase the monitoring of blood glucose, especially the overnight VG patterns, and modify insulin doses and glycemic targets. And CGMS is very helpful in this, and sensor augmented pump therapy is also helpful in reducing the episodes. Now, the common errors which has been observed in hypoglycemia. So top 3 errors in insulin administration which were observed in the studies were dosing irregularity, missing time, and missing of the dose. And top 3 errors preceding the hypoglycemic emergencies which were observed were missing a meal, using the wrong insulin, and using wrong dosage. So education is very important to decrease the risk of hypoglycemia. Hypoglycemia is easily detected through CGMS. So CGMS
Okay,
gives us
can we
a...
wrap up, Chhavi, because we are already time up.
It's done.
Yeah, thank you.
So if we see this glucose monitoring chart, you can see that on the days when the child, this is the glucose monitoring chart of a child of 14 years of age, who she was having repeated hypers as well as hypoglycemic episodes. But on the days of the leave, her sugar levels were not so high. So the factors which were observed was that she was skipping her insulin doses in school, and when she reached home, she was so lethargic and she was injecting excessive insulin to bring down the sugar. So she was having hypoglycemic episodes. This has strong correlation with the psychological stress of the child. And technological advancements like CGMS, sensor augmented pump therapy, and low glucose suspension pumps predictive have helped in reducing the episodes of hypoglycemia, and it has empowered individuals with type 1 diabetes to further reduce the frequency of hypoglycemia. So this ends my presentation. Thank you so much.